If you're studying for NCLEX soon, you need to watch the entire video. Let's look at 25 endocrine practice questions. Let's start with question number 1. A client receiving regular insulin by IV infusion. The serum glucose is 238 milligrams per deciliter and the potassium is 3.1 milliequivalent per liter. Which prescription should the nurse question before continuing the infusion? A. Add dextrose to the IV fluids. B. Continue the insulin infusion at the current rate. C. Administer potassium replacement as prescribed, or D, check point of care glucose every hour. Okay, so let's look at the answer. The correct answer is continue the insulin infusion at the current rate. This is the rationale. Insulin shifts potassium into the cells and can worsen hypokalemia. With potassium of 3.1 milliequivalent per liter, potassium replacement is the priority before continuing insulin therapy. Let's go to question number 2. A client with type 1 diabetes is pale, sweating, and confused. The finger stick glucose is 48 milligrams per deciliter. The client is awake and able to swallow. Which action should the nurse take first? A. Give 15 grams of fast-acting carbohydrate. Letter B. Administer regular insulin subcutaneously. Letter C. Prepare an IV infusion of normal saline. Or letter D. Hold oral intake until the confusion resolves. Okay, so let's look at the correct answer. The correct answer is letter A. Give 15 grams of fasting acting carbohydrate. So remember the rule of 15. And this is the rationale. The client is symptomatic with hypoglycemia. However, the client is awake and can swallow. Giving 15 milligrams of fast acting carbohydrate is the first thing to do. And then we need to recheck glucose in 15 minutes. Just in case the glucose in 15 minutes is still low, we give additional 15 grams of fast acting carbohydrates. So let's go to question number 3. A client with hydrocortisone for long-term hormone replacement develops vomiting, weakness, and a blood pressure of 82/48. Which action has the highest priority? A. Restrict oral fluids to 1 liter per day. Letter B. Give IV hydrocortisone and isotonic fluids as prescribed. Letter C. Administer rapid-acting insulin before meals. Or letter D. Place the client on a low-sodium diet. Okay, so let's look at the correct answer. It's going to be letter B. Give the IV hydrocortisone and isotonic fluid as prescribed. So remember this. This is the rationale. Vomiting, weakness, and hypotension suggests adrenal crisis. The priority is stress dose corticosteroid and volume replacement. Let's go to the next question, which is question number 4. A client has a serum sodium of 119 milliequivalent per liter and has headache, nausea, and concentrated, so that's the keyword there, that's the keyword, concentrated urine. Which prescription should the nurse anticipate? So letter A, increase free water intake. Letter B, administer desmopressin. Letter C, initiate fluid restrictions. Or letter D, start hypotonic IV fluids. Okay, so let's look at the correct answer. The correct answer is initiate fluid restrictions. So remember this patient has severe hyponatremia with concentrated urine, suggesting excess water retention. So remember, this looks like an SIADH patient, right? Fluid restriction is expected to help raise the serum sodium safely. Okay, so let's look at question number 5. A client has a urine output of 450 ml per hour and turns intense stirs serum sodium of 151 milliequivalent per liter and a low specific urine specific gravity after a head injury. Which prescription should the nurse anticipate? So think about this clinical scenario, somewhat related to diabetes insipidus, right? So letter A, desmopressin or DDABP. Letter B, loop diuretic therapy. Letter C, fluid restrictions. Or letter D, hypertonic saline. Okay, so let's look at the correct answer. It's going to be letter A. So this is desmopressin or DDABP. So why? Large dilute urine output, thirst, and hyperthermia after her head injury suggests deficient antidiuretic hormone. So this is where we're going to have DI in here. Desmopressin helps decrease urine output and correct water loss. Okay, so before we go to our next question, if you're new to this channel, please like and follow and help me get to more subscribers so that we can reach a lot of nursing students all over the world. Okay, so let's look at question number 6. A client is 8 hours post-op transpenoidal surgery. Which finding requires the most immediate nursing action? Letter A, nasal packing drainage or nasal drainage, mild nasal drainage with paint staining. Letter B, urine output of 700 ml in 2 hours with thirst. Letter C, sore throat after intubation. Or letter D, headache rated at 3 out of the 10. Which one is a priority in this particular scenario? So the correct answer is letter B. That's a lot of urine output, right? 700 ml in 2 hours, and the patient is already having thirst. So remember, high urine output with thirst after pituitary surgery may indicate acute water loss from low antidiuretic hormone. So there you go again. The nurse should assess fluid balance, sodium, and report the change promptly. So again, typical of a diabetes insipidus scenario. Let's go to question number 7. A client taking levothyroxine, so now we're now in the thyroid hormone, reports taking the medication with breakfast and calcium carbonate. Which teaching should the nurse provide? A, take levothyroxine at bedtime with a high calcium snack. Letter B, take levothyroxine on an empty stomach and separate it from calcium. Letter C, take levothyroxine only when symptoms return. Or letter D, take levothyroxine with antacids to reduce stomach irritation. Okay, you all, the correct answer is letter B, take levothyroxine on an empty stomach and separate it from calcium, because this is why. Calcium can reduce the levothyroxine absorption. The client should take levothyroxine, which is a thyroid hormone, consistently on an empty stomach, but separate it from calcium-containing products. Let's go to question number 8. A client with fever, severe tachycardia, agitation, and diarrhea is prescribed profylthiouracil, propranolol, and iodine solution. So this gives you a picture of what the condition is right now. Which action should the nurse take first? A, give iodine solution before profil thiouracil, which is a thyroid pill. Letter B, give profil thiouracil before iodine solution. Letter C, hold propranolol until the temperature is normal. Or letter D, delay medications until thyroid studies return. Let's look at the correct answer. It's going to be letter B. Give profil thiouracil before iodine solution. So this is the rationale. The anti-thyroid medication should be given before iodine, so iodine does not provide substrate for more hormone production. Beta blocker also helps control adrenergic symptoms. Let's go to the next question. So let's go to question number 9. A client with decreased levels of consciousness, hypothermia, bradycardia, and hypotension has a history of poor medication adherence. Which intervention should the nurse anticipate? So letter A, administer IV thyroid hormone as prescribed. Letter B, apply cooling measures. Letter C, prepare for rapid acting insulin infusion. Or letter D, encourage ambulation to improve metabolism. Okay, the correct answer is letter A. Administer IV thyroid hormone as prescribed, and this is the rationale. The findings suggest severe thyroid hormone deficiency with physiologic instability. The administration of IV thyroid hormone and supportive care are expected for this patient. And let's go to question number 10. A client who is taking prednisone for several months says, I stopped it yesterday because I felt better. Which response by the nurse is best? Letter A, stopping suddenly can cause weakness. So remember, this is prednisone, low blood pressure, and crisis symptoms. Letter B, stopping suddenly mainly causes mild stomach upsets for 24 hours. Letter C, prednisone should not be stopped during any infection. Or letter D, prednisone withdrawal is prevented by drinking more water. Okay, y'all, let's look at the correct answer. It's going to be letter A. Stopping suddenly can cause weakness, low blood pressure, and crisis symptoms. So remember, long-term steroid use can suppress natural cortisone production. Abrupt discontinuation can lead to adrenal insufficiency and crisis symptoms. If you're studying for NCLEX, I have an NCLEX Chrome notes that you could see on my user handle and YouTube, and you can access this via Link3 account. This covers everything from basic fundamentals of nursing to pharmacology, and this helps many students pass their NCLEX exam. Now, this is a NCLEX Scrum notes that I generated after years of looking at NCLEX exam. Okay, so let's proceed with question number 11. A client with blood glucose of 684 has serum osmolarity of 332, dry mucous membranes, and no ketones in the urine. So that's another key there. Which nursing action is the priority? Letter A, start isotonic IV fluid replacement as prescribed. Letter B, administer sodium bicarbonate immediately. Letter C, limit fluids to prevent cerebral edema. Or letter D, give a bedtime snack before the insulin administration. Okay, so what do you think it is? This is HHS, right? So the correct answer is start isotonic IV fluid replacement as prescribed. So this is the rationale. Severe hyperglycemia with high osmolarity and dehydration requires volume replacement. Fluids improve perfusion and help lower glucose before or with insulin therapy. Let's go to the next question. A client is receiving treatment for severe hyperglycemia. Which assessment findings best shows that the therapy is improving tissue perfusion? Letter A, the serum glucose decreases from 604 to 540 in 1 hour. Letter B, urine output increases from 15 to 14 ml per hour. Letter C, the client reports feeling hungry. Or letter D, the respiratory rate remains 28 breaths per minute. Okay, y'all, the correct answer is letter A. Urine output increases from 15 to 40 ml per hour. So remember, we're talking about perfusion. So this is the rationale. Improved urine output suggests there is improved renal perfusion and circulatory volume, which is a key goal during early therapy. The next question is, a client taking glipizide has a glucose level of 62 before lunch. Which factor most likely contributed to this finding? Letter A, skipping breakfast after taking the medication. Letter B, taking the medication with a full glass of water. Letter C, eating a high fiber dinner the night before. Or letter D, checking glucose before meals. Okay, so let's look at the correct answer. Our correct answer is letter A, skipping breakfast after taking the medication. So remember this medication is a sulfonylureas, and it increases insulin release and can cause hypoglycemia, especially when the meals are skipped early in the morning. Let's go to the next question. Make sure we can go there. Our next question is question number 14. A client using insulin glargine asked why it cannot be mixed in the same syringe with rapid-acting insulin. What's the best explanation? Letter A, mixing can change the action profile of the long-acting insulin. Letter B, mixing makes the rapid-acting insulin ineffective for meals. Letter C, glargine must be given only by IV route. Or letter D, glargine is used only to treat severe hypoglycemia. So between long acting and the rapid acting. So think about that. Why we can't mix them together. Okay, the correct answer is definitely letter A. Mixing can change the action profile of a long-acting insulin. So insulin glargine is a long-acting and should not be mixed because mixing can alter its long-acting effects, especially if mixing with a rapid insulin solution. Question number 15. A client has perioral tingling, hand spasms, and a positive Trousseau sign after neck surgery. Which item should the nurse keep available at the bedside? Letter A, calcium gluconate. Letter B, potassium chloride. Letter C, regular insulin. Or letter D, magnesium citrate. So asking about the antidote for hypocalcemia or the treatment. Okay, so let's look at the answer. It's calcium gluconate, letter A. Tingling, spasms, and Trousseau signs suggest acute hypocalcemia, which can occur after neck surgery. Intravenous calcium gluconate may be needed for asymptomatic, especially in this scenario, hypocalcemia. Let's go to the next question. A client has kidney stones, bone pain, constipation, and a serum calcium of 12.4. Which instruction is most appropriate? Letter A, restrict all oral fluids. Letter B, increase mobility and drink fluids as prescribed. Letter C, take extra calcium supplements with meals. Or letter D, remain on strict bed rest. Okay, so the correct answer is letter B. Increase mobility and drink fluids as prescribed. Why? Hypercalcemia increases the risk for stones and bone loss. Fluids and mobility help reduce calcium complications when not contraindicated. The next question. The client has episodic severe headaches, sweating, palpitations, and blood pressures of 210 over 112. Which nursing action is safest while awaiting treatment? So A, place the client in a quiet room and avoid unnecessary stimulation. B, encourage vigorous coughing and deep breathing exercises. Letter C, assist the client to ambulate in the hallway. Or letter D, give high sodium fluids to support the blood pressure. Okay, so let's look at the correct answer. So it's going to be letter A. Place the client in a quiet room and avoid unnecessary stimulation. Rational. These symptoms suggest catecholamine surges with severe hypertension. Reducing stimulation helps prevent further blood pressure elevation while prescribed treatment is initiated. Our next question. A client started on desmopressin, has gained 4 pounds in 24 hours, and reports a new headache. Which assessment is most important? Letter A, serum sodium level. Letter B, capillary refill time. Letter C, blood glucose before meals. Or letter D, bowel sounds in all four quadrants. Okay. Here's the correct answer, serum sodium level. Remember, desmopressin is given for hyponatremia. If they're going to be having headache, there is a tendency that it's already hypernatremic. So desmopressin or DDABP can cause water retention and hyponatremia. Rapid weight gain and headache require sodium assessment. Let's go to the next question. A client with morning glucose readings near 240 is suspected of having overnight hypoglycemia, followed by rebound hyperglycemia. Which action should the nurse recommend? Check a blood glucose level around 3 a.m. Letter B, increase the evening insulin dose immediately. Skip the bedtime snacks for 3 nights. Or D, treat the morning value with oral glucose. Okay, so the correct answer is letter A. Check a blood glucose around 3 a.m. Why is that? A 3 a.m. glucose helps distinguish rebound hyperglycemia after overnight hypoglycemia from insufficient insulin coverage. Before we go to question 20, if you are able to subscribe to this channel so that you get daily um, daily NCLEX type of questions, please do so. I appreciate that. Our next question, question number 20. A client has serum sodium of 126 and new confusion. Which prescription should the nurse question? Letter A, seizure precautions. Letter B, strict INO measurement. Letter C, half normal saline infusion at 125 ml per hour. Or letter D, repeat serum sodium level as scheduled. Okay, so the correct answer is letter C, half normal saline infusion at 125 ml per hour. So remember, this is a half NS is a hypotonic solution, and a hypotonic solution can worsen hyponatremia and can cause cerebral swelling. The nurse should question this prescription in a confused client with low sodium level. Okay, so our next question is a client with a blood glucose of 320 is scheduled for a CT scan with iodinated contrast and takes metformin. Which instructions should the nurse anticipate? A. Hold the metformin around the contrast study as prescribed. B. Take double the metformin dose before the scan. C. Replace metformin with a rapid acting insulin for a week without assessment. Or letter D. Avoid checking glucose for 24 hours after the contrast is being administered. Okay, correct answer is letter A. Hold the metformin around the contrast study as prescribed. So metformin may be held around contrast media when kidney function is concerned to reduce the risk of lactic metabolic acidosis. Next question. A client who takes insulin Lispro is served a meal tray, but the client suddenly becomes nauseated and refuses to eat. Which action should the nurse take? A. Give the scheduled Lispro and encourage fluids later. B. Hold the rapid-acting insulin and recheck glucose as directed. C. Give MPH insulin instead of Lispro. Letter D. Administer glucagon before the meal tray is removed. Correct answer, y'all, is letter B. Hold the rapid-acting insulin and recheck glucose as directed. And this is the rationale. Rapid-acting insulin should be coordinated with food intake. If the client will not eat, giving Lispro can cause hypoglycemia. Our next question. A client with fatigue, weight gain, dry skin, and constipation is prescribed levothyroxine, which finding after several weeks suggests the dose may be too high. A. Pulse rate of 116 with tremors. B. Decreased bowel movements. C. Cold intolerance. Or D. Weight gain of 3 pounds. Correct answer is letter A, 100 pulse rate of 116 with tremors. So tachycardia and tremors can indicate excess thyroid hormone replacement. Our next question, question number 24. A client has a morning cortisol test scheduled. Which medication in the history is most important for the nurse to report before the test? Prednisone taken daily for 6 weeks, acetaminophen used twice last month, docosate taken as needed, so this is docosate sodium, and then letter D, loratadine taken during allergy season. Okay, the answer is going to be letter A, prednisone taken daily for 6 weeks. So remember this, recent prolonged corticosteroid use can suppress, this is prednisone, adrenal function and affect the interpretation of the cortisol test. Okay, our last question. A client has dry mucous membranes, deep rapid respiration, abdominal pain, and a glucose of 486. Which result is most concerning before starting insulin therapy? Letter A, a potassium of 2.9. Letter B, a sodium of 134. Letter C, blood urea nitrogen, which is BUN, is 28. And letter D, urine ketones are positive. You guessed it right. Letter A is the correct answer, potassium of 2.9. Remember, low potassium is dangerous before insulin therapy because insulin drives the potassium back into the cell and can cause life-threatening hypokalemia. Share this video with your classmates, and as always, if you could subscribe to the channel, the more we have subscriber, the more we can reach a lot of nursing students prepping for their NCLEX exam.